Hi, everybody. Welcome to the podcast series on innovative healthcare solutions sponsored by the Conference of Consulting Actuaries with the CCA. Just as a reminder, this is a series of podcasts that we do focusing on the ever-changing world in healthcare and a lot of the innovative solutions that are coming out of this. My name is Ed Pudlowski. I'm president of Morningstar Actuarial Consultant. I'm also chair of the healthcare community within the CCA, and I'm going to be your host for today's session. As you can see in the background here, this is a little bit different than what you normally see on our podcast, and that's because we're doing it live from the CCA's annual healthcare meeting, annual meeting, not our healthcare meeting, taking place in the Cosmopolitan Hotel in Las Vegas. So we're here with about 600 attendees and presenters, and so it's just kind of a great, beautiful event. I'm delighted today to be joined by Kev Coleman. Kev is a healthcare thought leader, research fellow with the Paragon Institute, and he's also an author as well. So, look for his books. What's the name of your book?
Our Name is There.
Our Name
Coming
is
out
There.
December 2nd.
Okay, great. So, Kev, thanks for joining us today.
Thank you. It's nice to be in a podcast with an old friend. Usually I'm interviewed by strangers, and that's a different dynamic.
We've had a lot of conversations over the years, haven't we?
Absolutely.
So, Kev, you're doing a presentation immediately after we do this podcast, on what actuaries need to be thinking about with respect to AI, artificial intelligence. There's kind of this thought within the actuarial community, though, that as long as we're familiar with artificial intelligence, and to some, maybe that's mostly large language models, that we're okay. And in fact, there's kind of a saying in the actual profession that AI won't replace actuaries, but actuaries with AI will replace actuaries without AI. What's your kind of take on this?
Well, you brought up several important issues, and I'll try and unpack it as best I can. Well, one of the first things is that a problem for many people, not just actuaries, is this simple equation of artificial intelligence with large language models. And actuaries actually have to worry about a much more complex set of algorithms and statistical models that will apply directly to their industry. Something like large language models work well for AI agents being able to optimize some of your business processes, et cetera. However, if we're actually talking about things like predictive modeling, reserves, et cetera, you're going up against highly complex statistical models. Sometimes you might have multiple competitive models using hundreds of thousands to 1 million parameters. And that's a much different game. And I think it's very important for actuaries to begin to understand this, as well as the fact that even if you're correct that actuaries with AI are going to replace actuaries without AI, there's still the issue that actuaries are going to need to have a much better grasp of AI. What is the training data set? What are the possibilities and limitations associated with it? How much explainability do we have within a model? And how do we balance this against accuracy and reproducibility? So there's a lot of concerns that I think actuaries need to consider and start preparing for, rather than just thinking, oh, well, I know AI, I've used ChatGPT. It's going to be very disruptive for their market. And I think the smartest and most successful actuaries will be the ones who, aside from their existing professional skills, really start focusing on those aspects of their own skill set that AI will not be able to reproduce. Because at the end of the day, if you're trying to compete against analysis of data volume or a complexity of algorithmic models, a human being, even the smartest actuary, is going to lose. That's not the long game. The long game is being able to understand how these algorithms work, how they can be best applied, and how they can enhance the work you're already doing.
So maybe let's go a little bit into the future and kind of see, obviously AI is still adapting and evolving right now. I think the actuarial profession is very aware of some of the issues that exist with AI right now. The fact that we don't get necessarily the correct answer. I have my own kind of experience with that where,
And you're thinking about like LLM hallucinations, right?
yeah, and this one was just a case where the AI went out and grabbed some sources that were actually very inaccurate for the purpose that I was asking it to. So, I have this, I think I may have mentioned this to you already, that AI will give you an answer regardless of whether it knows the correct answer or not. But as it starts to evolve in the future, maybe some of these things go away. What are the things that actuaries need to be thinking about in terms of the future of AI?
Well, it's always how can you use this technology to be better? Let's take a step back 50 years. When you had really the advent of small scale commercial appropriation of software. So, what did AIs do? What did actuaries do in that situation? Well, they had to understand, how the software worked, how it could introduce efficiencies, what were its limitations and liabilities, and then what's going to be the smartest business approach to appropriate that technology. It's going to be very similar for artificial intelligence. Now, the issue with artificial intelligence right now is the rapid degree of development. There's a lot at stake, and because of that, that attracts a lot of development dollars, a lot of research dollars, and that means that you have very short release cycles. One of the things I joked about, and I'll probably say during my talk today, is I wrote my presentation 2 months ago, and I'm worried about 13% may still apply. So that's some of the stuff that's going to come into play, and I think one of the things, in the remaining minutes we might want to touch on is that the AI issue for actuaries is not just an aspect of the utilization of the predictive models and the probabilistic outcomes. It's also how are their clients implementing AI, and how is that going to affect the way we do things like cost modeling, projections, etc. That is also going to be an issue that I think the best actuaries are going to know like the back of their hands and the accounting clients.
Yeah, so, obviously, I think there's a lot of efficiencies that actuaries can get from using AI today. And I think we're starting to delve more and more into how it can take a play in actually the delivery of our services, the projections, the analyses, and et cetera, et cetera. How do you see that changing going forward in terms of how actuaries kind of use AI?
Well, that's we could speak for hours on that subject, but I will say let's take a very narrow view. One of the issues that actuaries will have to consider is the explainability and traceability of answers within different AI models and how they communicate that to clients and what kind of liability attends it. If you're using something like a large language model, at the current state of development, while there's things like retrieval augmented generation and various other techniques to try and make sure that they're more accurate, et cetera, you still have the possibility of hallucinations, and that needs to be disclosed to the client, et cetera. However, let's talk about an artificial neural network. That could have hundreds of thousands of cells, and the average actuary is not going to be able to go through the adaptation of biases and weights in each layer and how that actually affects outcomes. But they can talk at a high level of what the implications are, what we can explain and can't explain in terms of the operations of a complex artificial neural network, and make sure that there's informed consent with the client, so there's not any surprises or dissatisfaction. And ultimately, there's just going to be some profoundly exciting technologies coming out there in the future from actuaries. My suspicion is that you'll see the largest insurers start using very advanced AI for things like surplus line and more complex calculations, but ultimately you'll have people kind of leaving those companies and commercializing and allow that type of AI models to go to the small and middle-sized actuarial firms.
Yeah, I see it really having the ability to do a lot of scenario testing that may have not been quite as easy in the past. I want to shift gears here a little bit, because you and I have had also a lot of conversations about AI in the healthcare industry itself, which of course I think that actuaries need to be really aware of what's going on. So, how do you see AI changing, the diagnosis, the treatment, the administration, the research, and development that kind of goes on in the healthcare industry? I know that's a loaded question.
So the short answer is yes. Okay. And I realize that we have a limited amount of time. I'll say that what AI is going to do is expand American healthcare, world healthcare beyond the traditional model of detect and treat and move to predict and prevent. And this is where the actuaries are going to be so important, because they're the ones who are going to have to do the financial modeling that justifies the reimbursement of this kind of technology. You have technology like Sybil that was done in collaboration between MIT and Mass General, and it can take a single low-dose chest scan and do an outward probabilistic projection of lung cancer risk for 6 years. So we can do this before you're symptomatic. We can do earlier interventions that are less expensive, but we need the actuaries, people like Ed here, to be able to say, yes, this makes sense. And that's going to be a very big issue, I think, for the interplay between actuaries and carriers, as well as dealing with complications of how do I do cost modeling as an actuary when I have uneven deployment of AI tools across a provider network. So I think these are some of the big issues and exciting issues that actuaries are going to face in the near future.
Yeah, interesting you touch on that, because I do a lot of work with companies that are trying to find efficiencies within the healthcare system itself. And of course, now AI is becoming a much more integral part of a lot of those solutions. And it's fortunate for me that I get to help them figure out, what return on investment they're able to bring, if they're able to bring it, right?
Right.
And part of what I help them do is figure out if it doesn't meet kind of where they think it needs to be, what they need to do to kind of get there.
And can I interrupt you about that?
Yeah, please.
A very important aspect that people often misunderstand about AI is that unlike traditional software, it's typically not plug and play. Things like the administrative processes in healthcare, the clinical protocols surrounding the implementation and deployment of artificial intelligence can affect its performance. So that's a big issue, as well as the fact that something that performs very well in Massachusetts might not perform the same way in Mississippi because differences in population health. So once again, we're back to here's where you guys can provide a profound amount of value.
Yeah, and of course, the actual profession is focused on making sure that our models are unbiased in nature. So making sure that the data that the AI has been trained on and et cetera. So there's a host of issues and concerns there. And so you're absolutely right. I think it's very important that we understand what technology is being used and be involved in making sure that it's actually going to produce not only maybe we're not as integral to the quality of the solution. That's just not kind of our area, but at least making sure that it's driving the right efficiencies and it's not more costly than kind of the current methodology. The other thing that you and I have had some other conversations about, though, too, is the need to make sure that those efficiencies get down to the end buyer, whether that's the large employer who purchases on behalf of their employees, whether that's the federal government who purchases on behalf of Medicare, Medicaid patients, et cetera.
Yes.
Or it's the user who pays in the form of co-pays and deductibles and et cetera. So how do we make sure that these efficiencies don't just go into the profit margin of the organization that's developing.
Okay, here's where, I go and offend the American Medical Association. I think the vast majority of healthcare providers are imagining artificial intelligence as an additive cost, an incremental cost to a system that already consumes over 17% of our gross domestic product. I think there are people like myself within American healthcare policy who are trying to push different thinking and legislative and regulatory support that will help us increase transparency and also allow for the deployment of artificial intelligence tools that can allow us to be able to use less expensive healthcare labor, to be able to introduce efficiencies and start seeing that at a consumer level. It's complex because you're having to go after the ecosystem as a whole rather than just a point solution of, okay, how do I improve the medical outcomes for people who undergo, an MRI. So that's the short answer. But once again, we talked about, we could talk for hours. We could talk for months on that last issue.
Yeah, it's the healthcare field is again, this is all things we've talked about. It's such a data intensive, but it's also one of the most antiquated systems that exist out there today. So to me, AI just has a tremendous opportunity to bring huge efficiencies into what is really an inefficient system today. And I believe that it's critical that actuaries in their work, that they continue to make sure that those efficiencies kind of get through the entire system, because we obviously can't let the portion of our economy devoted to healthcare continue to grow. Otherwise, we'll all be working in healthcare at some point.
Yeah, and we're already getting to the point where we're threatening other budgetary priorities, Social Security, national defense, et cetera. This is an unsustainable model. So, the question is, how do we actually exert the kind of political pressure we need to have the reforms necessary to start containing and lowering healthcare costs?
Well, Kev, I really appreciate the time you spent here today. First of all, appreciate you coming in and being a presenter. I'll be sitting in your session here in a little bit, so maybe I've got a preview of what you're going to talk about, but I really appreciate that and appreciate you kind of sitting in here. And I'd like to encourage those of you that are listening here to, who also are members of the CCA and participate in our healthcare community, continue these types of discussions on our community platform. And of course, if you're not a CCA member and you're listening to this and you want to be, it's easy to sign up. Just go out to the CCA website and you can find all the information. And once you get there, make sure you sign up to the healthcare community. So, Kev, again, thanks for joining us here today. This was very insightful. I learned a lot, and I know our audience did as well.
Hey, always great to talk to the CCA. Thanks so much.